Every improvement begins with a single drop. One observation, one conversation, one courageous decision. At Care Drops Collective, we believe small lessons create safer care and bigger impact. Welcome to our first episode, When the Sky Opened. A story about aviation that is actually about healthcare, about how complex systems fail and how they survive. This documentary is based on historical events and publicly documented investigations. It is presented for educational purposes to explore patient safety, systems thinking, and high-reliability organizations. It is not intended to assign blame. April 28, 1988, 1:25 p.m. It was a bright, beautiful afternoon in Hawaii. For the crew of Aloha Airlines Flight 243, it was a day like any other. 90 passengers and 5 crew members boarded the aircraft. It was a routine 35-minute hop from Hilo to Honolulu, a familiar route, a normal day. But as we know in healthcare and aviation, extraordinary failures often begin on ordinary days. Hidden in plain sight, something was changing beneath the surface. The aircraft climbed peacefully to 24,000 feet. Everything appeared completely ordinary until the unthinkable happened. At cruising altitude, the atmosphere was relaxed. No one could have predicted that in a fraction of a second the sky would open. Suddenly, with a deafening crack, 18 feet of the upper fuselage tore away. At 24,000 feet, the passengers were suddenly exposed to the open sky. The decompression was explosive. The wind was hurricane force. The cold was biting. Yet, amidst the chaos, a different kind of system began to work. In the cockpit, the pilots faced a flight control nightmare. They were flying a convertible aircraft with major structural damage. Their only tools were teamwork and trust. This was not a movie. This was a display of extraordinary professional resilience. Communication didn't break down, it intensified. Teamwork didn't fail, it saved lives. 13 minutes later, through sheer skill and collective effort, Flight 243 landed safely. Out of 95 souls on board, 94 survived. After the survival comes the search for why. Investigations revealed that catastrophe rarely begins with one big mistake. It begins with many small ones. Metal fatigue, corrosion, stress fractures, signals that were present for years but were overlooked or dismissed as routine. The system had learned to tolerate risk. Small deviations became the new normal. In safety science, we call this the normalization of deviance. We often use the Swiss cheese model to explain this. Every system has layers of defense, but every layer has holes. When those holes align, a disaster slips through. Although this story unfolded in the sky, its lessons belong in every hospital, because healthcare systems are just as complex and just as vulnerable. A missed signal in a handoff, an assumption during a medication check, a small deviation in protocol. These are the weak signals we must learn to hear. High-reliability organizations don't just hope for safety, they design for it. They expect failure, and they empower every member of the team to stop it. These principles transform a hospital from a place of risk into a culture of safety, sensitivity to operations, deference to expertise, a reluctance to simplify complex problems. Safety is not a project, it is a leadership strategy. It requires a commitment to learn from failure without assigning blame, and to build systems that protect both patients and professionals. Like the pilots of Flight 243, our teams must be prepared for the unexpected. Through simulation and a culture of continuous learning, we build the resilience our patients deserve. We do not study failure to assign blame. We study failure to prevent its recurrence. Tomorrow, each of us has the power to make our system just a little bit safer. Every safer hospital begins with one observation, one conversation, one courageous act. Like a single drop, creating ripples far beyond what we can see. Thank you for joining us at Care Drops Collective. Together we build safer care and bigger impact.